So good evening, everyone, and thank you for attending today's webinar on optimal care for complex conditions, the collaboration between integrative medicine, integrative MD and health coach with Dr. Stephen Bock and Susan Levin. Attendees are encouraged to submit questions using the chat box over to the right. Questions will be addressed throughout the interactive discussion with a longer Q&A at the end, and registrants can expect to receive a recording of this presentation within 2 to 3 business days via email. So first, I'd like to introduce the president of ACAM, Dr. Avi Herskowitz, not only an international leader and educator in the field of personalized and integrative medicine, but has an extensive background with cardiology, immunology, and autoimmunity and virology. And we are lucky to have him with us here today. Also, we have Dr. Howie Hinden. Dr. Herskowitz, if you wouldn't mind taking it from here, introduce Howie.
Thank you, Jordan. I'm really super psyched up and excited to have real cases being presented today by 2 experts. One that will be, I think, described in detail by Dr. Pat McBride in just a moment. Thank you, Dr. Hinden, for organizing this particular session between the 2 experts. I look forward to helping everyone moderate and getting the most out of it. I do want to make time at the end for questions from the audience, so we'll make sure that that happens this time to a greater extent.
And hi, I'm Howard Hinden. I am the president of AAPMD, and I love the wonderful collaboration that we have with ACAM, and this is going to be a great ACAM Med Talk. And not to spend too much time, I want to introduce our lovely co-host and moderator, Dr. Pat McBride. Hi, Pat.
We have a great bang up CBD lecture coming for you tomorrow with Dr. Kathleen Carson, and it's a real perspective that comes from a practitioner as well as a person who's a cancer survivor who has used CBD in her practice, and will show physicians and dentists alike how we can benefit from understanding what this is and how it can benefit our patients. So that'll be for tomorrow night.
And Dr. Merritt, the following week, a week from today, I guess, we'll begin our chelation therapy review. One of the world's authorities in chelation therapy. And we very much look forward to having all of you join us at that time as well.
So I'd like to introduce Dr. Stephen Bock and Susan Levin. And Dr. Bock's been practicing integrative medicine for over 35 years. He attended New York Medical College and received his MD in 1971 and was board certified in 1977 in acupuncture as well. Dr. Bock is the co-founder and co-director of the Rhinebeck Health Center. He's a diplomate of the American College of Family Practice, a diplomate of the American Academy of Acupuncture, and diplomate of the American Academy of Anti-Aging Medicine. His medical practice merges traditional medicine with alternative and complementary medicine, combining the modalities of acupuncture, functional and nutritional medicine, homeopathy, herbal medicine, and environmental medicine into an integrated medical model for optimal wellness. Susan Levin, who's my friend and also a certified health coach, I consider her like a medical detective. She's one of these people who digs in deep, goes down, finds out what's going on, and really helps make a difference in trying to figure out what's going on with our patients. For over 30 years, she worked alongside her husband, Dr. Warren Levine, and pioneers the world of integrative and alternative medicine. Today, she carries on with their mission through educating her clients about possible options, treatments, and protocols that are available to them by helping them to build and coordinate a support team to steer a course towards complete healing and recovery. It's not just about the patient, it's about the whole team. Susan's an advisor to the ACAM board and serves on the educational committee. She is a passionate advocate for integrated medicine and patient access to care and has testified at government hearings. So without much ado, ladies and gentlemen, we give you Dr. Bock and Dr. Levin.
Hi. So I want to begin because I think it'll be helpful by sharing how my clients get to me and how I prepare them for seeking out a an incredible physician such as Dr. Bock, who we would have worked with, and we'll be discussing two particular patients, one with neurological Lyme and one with chronic issues, viruses, and so on. So when people reach out to me, it's either because they've been referred from a medical practice that has gone as far as they can go, and then they turn them over to me and say, we can't go any further, it's for you to handle. Or it might be through a referral or actually a former patient of my husband's. So several of those have been following me and working with me. So when they reach out to me, I begin by spending a little time on the phone with them, and then if we're a good fit, then what I'm going to be doing is asking them to fill out extensive questionnaires, sending lab results, and beginning by truly digging deep and looking at history, symptoms, medications, social history, issues with possible mold exposure, viruses, bacteria, what's worked, what hasn't worked. And I put together a report that can entail 10 to 14 pages, and will also include some recommendations that I will be reviewing with Dr. Bock in terms of how we might proceed, so that when we start, we are already ahead of the game. I've got a master report for him. I've submitted it to him, previous labs, recommendations, and with his review, of course, before the first visit, once the client, or his patient as we call it, has chosen, then we can get started. But there's no way that my working 10 or 12 hours or 8 hours, whatever, with these clients, that he's going to get that information. So if you would go to a functional medicine doctor, and as much time as they spend, they're not going to be able to dig into all the information that I am providing for them. So then we can really get up and get running. So let me continue on. When I provide this report, I prepare it as a master. It's a master that I feel if I never saw my client again, they would have copious total information that they could take to any doctor. They would have significant lab results. They would have already the start of a nutritional diet. They would have beginning supplements. And there are a few specialty labs that I'm able to order for them. Once I've been able to do that, then all of that information is going to go to Dr. Bock. I've also had the opportunity to work with other incredible physicians around the country, and really have had the honor, because of my husband's work and because of the way I've worked over the years, to reach out to physicians and be able to say, is this the kind of patient you would like to work with me? I don't have all the answers. Dr. Bock doesn't have all the answers. So I look outside as we proceed. I look at optometrists that work with neurovisual disturbances. I work with Reiki therapists. I definitely look at airway breathing issues, and I've learned so much about that from Dr. Hinton. And I also look at nasal issues, chronic sinusitis. So I truly go beyond where other physicians don't have the time, but I look at this as really being able to dig deep, dig down, and get to the root of the problems. One of the other things I do is review labs. The labs may be 2 or 3 years old, or they may be significant labs that the client wishes that I include in the report. So I end up putting together a summary of what all those significant results are. And when I look at labs, the way I was trained, I don't just look at the norm, the reference range, as most doctors do. I look at the low end, I look at the high end, I look at whether there's inflammation. And certainly today, hypercoagulability is a big issue. So that's something I have been very aware of for years, having taken a course back in 1985 with Dr. David Berg. And so not only do we do fibrinogen testing, but we do a full thrombotic marker panel. Things don't always show up on the fibrinogen results, so we want to look deeper. We also want to spend a lot of time looking at viruses, because viruses are still not being addressed in this country as they are in Europe. And the same is true with parasites and candida. So these are all the kinds of issues we're going to look at. So when I present this information to Dr. Bock, he's reviewed it, he has it on the table, and with the patient, myself, and Dr. Bock, we can begin. And often that will be with, again, we've moved so fast ahead that he can order additional labs, and we can begin potentially treatment if it is appropriate for that particular patient. It's very exciting for me, and by the way, I follow up, I attend most of the consultations with my clients and with, as in this case, Dr. Bock. Even though I'm in Atlanta, I have clients around the country, and Dr. Bock, as an example, is up in Rhinebeck. So once we have these consultations and we have a three-way, we've reviewed labs, I put together a summary. At Dr. Bock's request, I also review it with my client and make sure that labs are being done, all of the questions have been answered, and then we can move from there. When Dr. Bock and I started to work with one another, I reached out to him because I had a young man who's actually, if I can share, his mom was a patient of my husband before she became pregnant with him. He had been diagnosed with Lyme. My husband worked with him until he was relocated. And then he was quite unhappy with the care he was getting. He reached out to me. And with that, because he's upstate New York, and so is Dr. Bock, I was then able to reach Dr. Bock, send him all this information. And even though I didn't have the notes or the chart, and my client had lost it, I fortunately have a very good memory and was able to begin to look at the neurological issues and anxiety. This particular young man was 26 years old. He had been suffering, he had anxiety, he had panic attacks. He just wasn't able to deal with everything going on in his life, except the fact that he had to work. So he did work a full-time job. Dr. Bock and I started to work with him, and because we had quite a few labs, we did have to add on, bring some labs up to current. So we ordered Lyme testing, we ordered virus testing, bacterial. I began to work with this client of mine with his diet, which had certainly been a challenge for him. I had begun to work with him with supplements and with herbals. And then we were able to begin to start the process. What we find is during these consultations, there are a lot of questions. And again, things come up that don't usually come up. There are personal issues, previous medications, again, which even though I've summarized, they may come up. What is this particular young man, in this case, having problems with? And the other great addition, in a sense, to having me on board is that when there's an emergency, my client can reach out to me, and then I can reach out to the doctor. So I'm in close touch. I review labs on an ongoing basis for the doctors I work with, and I provide a summary report, which I review with my client and review with the doctor, and then when we move on to the next appointment. For this young man in particular, while he had chronic Lyme, we felt we should put him on a course of intravenous antibiotics. However, that was not alone the only thing we did. We also included intravenous antifungals, herbals, botanicals, and we very carefully monitored how he was improving. Where were the ups and where were the downs? It took I would say about 2.5 years with constant work. He also went into Dr. Bock's office and had a variety of therapies, UVL, with the cleaning of the blood, IV ozone. intravenous nutrients. And we did a variety of therapies constantly to see how he was responding. I was also in touch with the family, and this was a unique example where the family asked me to be a coach. Because with a lot of people with chronic Lyme, the family doesn't recognize the issues, doesn't understand the complexity, and because someone looks terrific or fine or doesn't look sick, they are not understood. And so in this case, I did have some sessions with the family to talk about what we could do to provide this young man with the additional support he needed. 2.5 years later, we were thrilled to give him a vacation. Now, the vacation didn't mean that he could go back to eating what he wanted or that he didn't have to take any supplements. In fact, he had to follow a protocol, herbals, supplements, and then to return to Dr. Bock. In this case, he was so happy and feeling so great. He was exercising. His visual issues had disappeared. We had arranged for him to get visual therapy. He wore prism glasses, which helped him. He wasn't having headaches, floater issues, or seeing what he claimed were things that he didn't understand. So we truly looked at this. About, I would say, he's been off the hook for well over a year, and he reached out to me a few months ago and said, Susan, what do I do? I've been exposed to mold. That's a big issue. It was one we had dealt with him about previously. In fact, his family had to move from their home because of toxic mold exposure. And that meant addressing the furniture, the clothing, everything in the house. We were thrilled that they were able to relocate. We did treat him for mold toxicity with nutrients and something called polystyrene, which helps pull the mold particles out of the body so they are excreted. I told him he needed to get out of the office where he was working, which he said he was not able to do. But then what we did was we got together, reached out to Dr. Bock, and got back on board. And I'm happy to report that he seems to be doing much better. So when you work with chronic illness, and this could be colitis, it could be Crohn's disease. When you look at chronic illness, we're looking at inflammation, and these are things that we constantly need to work to down-regulate. We need to reduce the stress on the body, and we need to go from there. So again, he's doing beautifully. But the
Susan, this is Avi. Since we don't have Dr. Bock on,
oh great,
I mean, we don't seem to have
we
him.
don't.
on, so
Okay.
Yeah, his computer is not working anymore. So sorry about that. We're going to continue with that.
Okay, so I think what you're reminding everyone here and in the audience is, if you're talking about that case you discussed
Mhm.
briefly is a very serious case.
Mhm.
It takes 2.5, 3 years to fix it, and that's because by the time they come to see you and Dr. Bock, in this case, they have a total system collapse.
Correct.
I mean, they have no ability to repair. They have very limited ability to eat food.
Mhm.
They have little ability to absorb food. So,
Right.
for example, unless you have so what you're saying is, unless you have a comprehensive approach, in this case, it's a Lyme mold case, but it could be an autoimmune case. It could be a cancer patient case. Once you have that level of dysfunction, you have to have a global approach.
Correct.
I want to also advocate for the use of health coaches in this type of a setting because, frankly, what you're describing takes around 4 or 5 different full-time equivalents at the office.
Right.
So you're actually a very efficient and effective method of getting information, the key information
Mhm.
that's already been screened, because you also have a deep medical background from all that experience. So comprehensive, what does that mean particularly to the dental group on the line? It means vascular. Unless you have the ability to get the nutrients all the way downstream, you're not going to be able to do cellular health. You have to have GI nutrition. You have to have gut repair. You have to have metabolic systems that work and repair systems that work. The case
I was describing a case we worked on a few years ago and how we've gone about working with him and continuing to work with him since he's had a bit of remission. And I think that's an important message. And I think that's true, before I turn it over to Dr. Bock, that with anyone with a chronic illness, it is a lifelong job, if you will, to really take care of your body, love your body, provide the nutritional support, and follow up with the therapies, the modalities being recommended, as well as looking at spiritual issues, meditation, which Dr. Bock feels very strongly about. And there are several programs available that many physicians, functional medicine physicians, require their patients to do, because as part of the healing, we need the emotional healing to go on. So, Dr. Bock, let me turn over to you now. So you can chat, and then thought maybe we could talk about our current client patient that we are sharing.
Okay, well, one of the things when I work with Susan, first of all, when I see a patient, I look at the whole context. Like I'll see a patient who has seen a neurologist and a cardiologist and an internist, and I remember way back, Jeff Bland once gave this circle of inflammation, and then from that circle you had all these the specialties, all these columns like immunology, gastroenterology, cardiology, and Jeff said, well, sooner or later, each of these specialists know very much about nothing, because they don't connect with the different specialties. They don't connect with the person who's taking care of the patient. So it's really important to communicate and to have the context for the patient. That's one thing I appreciate with Susan, is that when I work with her, she facilitates with the patient and usually gives me a great supplement to my history, which means that if I have a visit and I get a whole history of the last month that they've been through, what supplements they're taking, any problems they're having, then I can just go right in my visit, right to the crux of the problem. I don't have to write in my note, oh, this is this, and you had a cold a week ago and you did this and everything. Susan does that. It's really helpful, so, and she always has something to add. So it really helps in the integrative. And one of the things I was telling Howard when we spoke, when I look at a patient, especially with a Lyme patient, I have something called my wheel of function, because again, a lot of times specialists that see people, they're looking for disease or they're looking for structure. They're not looking for function. And so it's really important to find out how the patient is functioning. I love when I get a patient who's seen 5 or 6 specialists and they have these diagnoses, but they don't know really what to do. They're not well, and they don't know what supplements to take. They don't know, how to relax and how to calm down their nervous system. I just had someone in today who was seen in Mayo, and she had a multitude of problems. It turns out that she has long-standing tick-borne disease, Bartonella, Lyme, and Babesia. But she had autonomic dysfunction. She had a ganglionopathy, pelvic floor syndrome. She had all these diagnoses, but this 15-year-old girl had been sick for 10 years, and nobody looked at the problem. So that's what I think Susan probably alluded to, that it's detective work. You have to look and you have to find out what's in their house, and are they exposed to mold, or, do they go outside a lot? Do they hike? Do they, have exposure? In my practice, I see over 50% of Lyme patients, and 50% don't ever know they were bitten. So it's important to just ask the questions about their whole environment.
Right. And the other thing is that I can take the time to talk with my clients about their cleaning supplies in their home. And our current client, Dr. Bock's patient that we're working with, has had headaches. And so when I started to ask her about her cleaning supplies, I was amazed at the product she was using, providing her with the information. And I provide links about ingredients. This particular person was using Sensodyne toothpaste. And by the way, one of the things we're going to want to do is get her to a functional medicine dentist, because she's had 3 root canals in 10 years. She's got gum recession. And again, these are the things that I will bring to the table, discuss with Dr. Bock, with the client. So because we've got all of these areas we need to dig into, and we can't do them all at once. So on the table will be that she is going to be going to a dentist, and actually referring Dr. Hinden, because we're in the same area. And I feel that this will be a very important piece of the puzzle. I've also gotten social history. She worked years ago at a hospital. She was involved with working with people that were sick. She's lived in a mold-infested home as a child. So again, childhood history is very, very important. And again, those are all the things I'm going to bring to Dr. Bock as we work together.
It's like peeling an onion. But what you
Right.
really have to know is you could peel the onion and you could see all the layers, but you can't do it all at once. Because first of all, you confuse the patient. Also, you'll complicate it. So you have to prioritize and pick, should she detox her? Susan could help her with take away those chemicals, substitute this, go over your diet. Are you allergic to anything? So it's a process of both elimination and prioritizing where you impact on the patient and what you do. Now, Susan was mentioning meditation. I always give my patients, I have this free meditation by one of my spiritual teachers. It's, if anybody wants it, it's Lou Cordero, CORDERO.com. You go on his website. He has an 11-day meditation course. It's free. And the patient gets on day 1, day 2. One of the things that he does different than just sitting down and meditate, he puts a lot of prayer and divinity into it and calling up, someone's better angels and things like that. It's a very, very intense meditation. So I would recommend that people give that to their patients.
There's also a program for healing the brain. So there are several programs like that. And again, I think those programs can be very important. And in the previous individual we worked with, I know that Dr. Bock referred him to a psychiatrist for some additional help. So we have to be able to reach out to many, many people to truly look at and help us address healing and issues that are not something we handle. It's not in our domain. And that's why, for me, AAPMD and ACAM are so important, because it is truly bringing together doctors and dentists to work on healing and addressing chronic illness, especially inflammation in the mouth.
So this is Howie. Both Dr. Hershkowitz and I believe that health coaches are going to be so important in the future, because in order to better resolve and get better outcome, chronic healthcare problem. Huh? Lost me? You hear me now?
I have you, Howard. There's no issue.
In order to get better outcomes, that you need to gather the information and put that together. And no one office can do that and run their office efficiently. And that bridge is going to be the health coach. Susan is certainly near the top of the of that mountain, because she had so much experience. I know Susan for 40 years or more?
Yeah,
When you got out of high school and started working with
right.
I lost you there for a second.
but she's had experience in running a top level integrated medical practice. But and I'm looking at our audience on this webinar, and there are health coaches and dentists and physicians. The process of how do you get to work with doctors? Your experience, you know, a lot of doctors all over the country, but somebody who's just completed their health coach certification, how do they get started and connect with doctors to do this type of services you offer?
Well, I'm not sure about that. I had definitely a jump in, right? Because attending all the conferences I've attending all the years, I have the ability to reach out and reach, as an example, Dr. Bock or other medical practices and other people I have known in the past to share with them what I do. And it does take time for doctors to get to understand what my role can be. And it amazes me that there aren't more physicians, because patients that are chronically ill require more hand-holding. They require being supported, nourished, being there for them, being available for them. And that can include calls 11 o'clock at night. So we want to keep that going. But again, we can't do it alone. But being able to be the link between my client and Dr. Bock, I can reach him more readily, text him, call him if I need to, where there are decisions that need to be made that I can't possibly make. So I consider what Dr. Bock and I do to be a dance, if you will. It's our ability to communicate, ask questions. I'm constantly learning from him. I might bring something to the table or ask a question or say, you think it's time to do this? So we've got our minds that we're putting together with extensive knowledge, bringing that to the client, to the patient, so that we can move them forward.
And I think that ACAM is a wonderful resource for health coaches where they can
And that says
learn
it
more
all,
of this information and get to meet
Any questions?
and get to meet the integrated doctors. So I have a question for you, Steve. We have other healthcare practitioners who probably see a lot of patients with Lyme, but don't think it's part of what they should look for. If you're a dentist doing sleep or airway, you may not know how it relates to Lyme. Could you talk a few minutes about how other practitioners who don't really treat Lyme disease really can play a role in support of Lyme patients?
Well, Lyme patients are very complex. They have a lot of, not only Lyme disease, but they have autonomic dysfunction. They have neurological problems. They have, metabolic problems, sometimes loss of weight, sometimes gain of weight. So, it pays to have people consult like endocrinologists. I like consulting with neurologists because neurologists are great at making diagnoses. They just don't have too many things in their bag of tricks. They're great diagnosticians. The only thing that I find is when you have someone who's Lyme literate and infectious disease has an opposing point of view, and they get out to a lot of specialists. So a lot of specialists have this view that Lyme is treated for 3 weeks and you can't possibly have it. And so it's like Susan says, it's a dance with the specialist. A lot of times I'll coach my patients and say, because I'll try and get ahead of it. I'll try and be telling them what could happen. So they go to a specialist and I say, look, you can't talk to the neurologist about some of your concerns, or if you're fighting with them or you want something that they're not willing to or don't know or don't willing to do. So I say to them, if the specialist starts saying, talking down to you and low, this is what I say, you tell them, could you please call Dr. Bock? He's there to talk to you. Unfortunately, I can't believe how many practitioners would just say, I'm not going to call him. First of all, it's not ethical, and it's bad medicine to not communicate to someone who's taking care of someone. So I think that is both a good thing to talk to specialists and get them involved, but you also have to make sure that they buy into taking care of the patient in a way that the patient wants. A lot of times people come away from their consultants and hold their eyes up and say, why'd you send me to that guy? Well, there was a certain aspect of endocrinology. I know a lot of functional endocrinology, but I want to make sure there's no endocrinologic pathology that's their specialty. So it's important to have that dance with them.
So Steve, one more question. A lot of, let's say, other healthcare practitioners who don't see a lot of Lyme patients, they may not know how pervasive and how extensive it is. Are there some screening questions or tools that any practitioner could add to their practice that would help them identify somebody who should be followed up with some Lyme tests? And second part of the question is, what is the best test for Lyme?
Well, so the testing for Lyme is not very, very good. So in other words, an ELISA, which is a screening test where you have all the antigens bunched together and you test for that has 49% sensitivity, which means it's like flipping a coin. If you do an ELISA and a Western blot together, that's only 65% sensitivity. Now, lately, they're coming out with the immunoblot, which is a much better test than the Western blot. So that's the state of the art. But what happens is when you do antibody testing, you're just testing for whether they come in contact with the pathogen, IgG, or whether it's IgM and it's active. You can then do a PCR. The problem with PCR is if it's positive, you can hang your hat on it. If it's negative, you can't say they don't have it. You might have to do 3 or 4 tests. So what I find a lot of practitioners do a test. Oh, and one other thing is when you do Lyme testing, you can have a Lyme patient who has Lyme and they'll have a negative test. But a lot of times when they go to their PCP and he sees the negative test, he says, you don't have Lyme. But they have all the signs of Lyme. So I have a slide that I got from a physician that died who was a Lyme expert. It says absence of proof is not proof of absence.
Right.
And I always have that mantra when I'm seeing a patient, because they'll have negative tests and all of a sudden I see they have this symptom and that symptom and this symptom. And it looks like Lyme. If it looks like a duck, it swims like a duck, quacks like a duck, it's probably a duck. So one of the most important things I tell physicians is if you suspect Lyme, think of the clinical first. It's supported by the test. It's not proven by the tests.
There's another quote I want to throw in here, and that is, you can't make a diagnosis unless you think of it. And because we've all been, divided up into all these bits and pieces and only get 15 or 20 minutes with a physician, how are they ever going to go beyond? As a matter of fact, I had an experience with my grandson who had an issue. I went to the nephrologist and I had questions, and the nephrologist kept saying, don't talk to me about anything except the kidney. And that's why I believe, and I think you would agree, Dr. Bock, we are seeing so much chronic illness in this country. It's people are not being heard, they're not being listened to, they're not having proper physical examinations, which can be very revealing. And those are the things that I know you do in your practice. It's one of the first things you do in doing a thorough physical exam, which is so very important.
Right. And getting back to the first part of your question, Howard, I have like a 30-page questionnaire that, just asks all the questions. And it concentrates, for about 3 or 4 pages on things that you see commonly in Lyme, like, headaches, joint pain. But then when you see a headache, if it's in the back of the head, you could think of Lyme. If it's on the top of the head, you think of babesia. If it's on frontal, you think of Bartonella. So each symptom can be kind of broken down into that. But you'll see your Lyme symptoms, like I said, migratory, joint pain, fatigue, obviously, big thing, cognitive dysfunction with all the Lyme and all the co-infections. Then there's particular symptoms that can trigger thinking about babesia. So babesia, if someone has panic attacks, anxiety, like chest tenderness, air hunger, not when they're doing exercise, but just sitting there, all of a sudden they'll be unable to catch their breath, night sweats, chills. Then you think of babesia, which is like a malaria-like parasite and needs different pharmaceuticals than the regular antibiotics that they're treated with malaria drugs. Bartonella is one of the biggest problems lately because it's bacteria that goes into the endothelium, and so it goes into many tissues. When you're thinking of Bartonella, you think of worse neurological signs than even Lyme, cardiac signs, ophthalmologic signs, cognitive and brain signs, and limb swelling. So a lot of times, like I'll give you an example. I saw a woman that I treated for Lyme. She came back to me about 5 years later. She was diagnosed as lymphoma by her oncologist. So I took her history and I said, boy, I think these lymph swellings are Bartonella. So I called the oncologist and I said, look, how much time do I have before you're wanting to do chemotherapy? He says, okay, 6 to 8 weeks. I said, okay, I'd like to treat her for Bartonella, and then you'll see her and we'll see how she is. In less than 8 weeks, her lymph swelling was down on the antibiotics for Bartonella. She was just ready to go into chemo. So it's really important to have this context of looking at everything, just like Susan said. If you don't think of it, the oncologist is going to think, hey, that's a lymphoma. Because when you get the biopsy, it'll look hyperplastic, and the Bartonella causes lymphoid-like picture in the lymph glands.
This is Avi for both of you. I mean, 40 years ago, when we worked in academic medicine, no one thought about autoimmunity because it was rare. It just didn't. It wasn't on everyone's agenda. And now we have Lyme, which has now evolved into the second, third decade of people's knowledge, and people are beginning to think about it. But again, it's like canaries in the mine. Where the average doctor thinks either it doesn't exist or I'm not interested in it, but it may be an autoimmune state, a post-inflammatory, post-infectious autoimmune state. But in essence, for this type of a session that we have today, Susan articulates the need for multiple hours of investigation, number one, and many different referrals that take care of the canaries in the mine, who are telling us what the world is really about and how certain genetically inclined people are inclined to be more severe than the rest of the population. But the rest of us are exposed to the same level of toxins, but perhaps don't have the same immune reactions to them. So we need extensive, I mean, every one of us on the audience today needs this type of care, except it's not emergent or it's not as urgent. But in terms of the COVID experience, COVID is unearthing also these canaries in the mine. And it's telling us the same type of things, that if you're getting super sick from COVID, then that means that there's something fundamentally wrong with your reserve system. There's something fundamentally wrong with your immunological system. And this is the basic message here is, whether it's Lyme, cancer, autoimmune disease, or cytokine storm from COVID, it's that we have to heal ourselves on a level that is not consistent with the 8-minute consultation that we get in routine care.
Right. Correct. Right.
So,
Right. Yes, Avi.
I have a question for both Avi and you, Steve. When we were talking on Sunday, you talked about how you're using peptide therapy
Oh.
in treatment of some of the Lyme patients. And I know that's a big part of the treatment that Avi offers. So maybe a little bit of discussion about how peptide therapy is being used to treat Lyme patients.
Well, you know, as Avi said, Lyme patients have a lot of inflammation. They also can have a lot of GI symptoms because they may be on antibiotics. They may have yeast in the intestine. So a lot of times I'll put them on a peptide called BPC 157, which is very good for inflammation, also good for any inflammatory problem in the gut. I'll often, with the Lyme patients and also COVID for sure, give them a thymosin alpha 1
Right.
because that's a boost to the immune system. Now, if they have autoimmunity with it, then I'll use thymosin beta 4, which is also for the thymus, but also is good at damping down an overactive immune system, and is also very good for repairing tissue. Anything else you use, Avi?
No, Steve. No. I use the same stuff as you do because it's completely logical, but also expressing it to the rest of us. I think that we have difficulty describing why it wouldn't be rational for all of us to be on BPC 157.
Yeah, no, I think
And
Because-
thymus. And thymus.
And that's what I mean by the canary in the mine thing. Okay, I gave a grand rounds at Albert Einstein in the early 70s to date me as early as you on Hashimoto's thyroiditis as a rare case.
Right.
Now, 1 in 6 people in the United States has some form of thyroiditis. So we're talking about an explosion of autoimmune predisposition because
that's
we're
one of the biggest
exposed to
things.
immunostimulants that are a bit chaotic and less modulated. We don't know how to modulate. And it's not just the 1.1% of the population any longer. It's closer to 10 to 15% of the population. And this is what Lyme represents and mold represents. It's a canary in the mine thing that's trying to warn us and trying to guide us and teach us. And hopefully those of us on the line here and the audience don't have to have the severe form of this in order to learn those lessons.
Yeah. I remember 30 years ago, cases were coming in. You know, if you took care of their yeast and you took care of their allergies, they walked out and you saw them a couple months later. They were great. The cases I'm getting in now are so complex with autoimmune encephalitis, small fiber neuropathy, dysautonomia, POTS, gastroparesis, affecting every organ system, neurologically, metabolically. It's just amazing what's happening. And I think at the bottom of it is that our bodies have become toxic and our immune systems aren't reacting like they used to, much weaker and much toxic.
It's not just the weakness, I think, for the audience. To me, it's chaotic. So it's weakened by certain, so it's diverted but it enters into this chaotic phase where that's the best word I come up with. So you have to modulate it back down. So you do that by less stressors, of course, on the system level, and less stressors on the infection level, and less stressors on the, on that chronic stimulation, that whether it's metals or plastics, whatever it ends up to be, that you then need people like Susan to figure out, because we don't have 16 hours to spend. We just don't. And, when you look at that system versus the 8 to 10, 15 minute primary care visit, or you go to the world-class center like the Mayo, where they'll spend an hour and a half, or at Hopkins, where I have my cardiology fellows spend 90 minutes a time and I'll spend 30 minutes. It's nowhere close to the capability of understanding that you may have post-COVID myocarditis, you may have post-COVID encephalitis. All these things are coming out, unearthing, and people are running around like they're confused as to what's happening, where a virus with a single receptor is unearthing the whole repair cascade.
Mhm.
And so that's really what's going on, and the lessons need to be learned by all those folks on the audience today, that this is the unearthing of a
Yeah,
system
and
that can be
so-
easily
so-
collapsed. It's a tipping point.
Yeah, typically you have to look underneath the COVID. COVID is like the tipping point, but there's a history of, bad diet, smoking, stress, all the things that have impact diabetes. So all the things that someone lets themselves go and all of a sudden then they get a COVID and it just ravages everything.
Right.
Yeah.
Right, exactly.
So I know I'm looking at the list of attendees, and
So we do have quite a few questions.
Okay.
Okay.
I know that looking at the attendees, there are people from very different disciplines. And one of the places, or three of the places you can go to learn about this information is the organizations that we represent. ACAM being the longest history, like 30 some odd years. Dr. Bock, you're going to be the incoming president of what group?
ILADS,
Tell us a little bit of what is ILADS?
International Lyme and Associated Diseases
And
Society.
and you-
We're a group that started out really, being innovative about Lyme outside of
And we lost him again, but I think that's great. But and one of the reasons we've been reaching out to you, Steve,
like
because
they
we
get
want
morphed, and so now we're dealing with all the outliers that happen with Lyme disease, like mast cell activation and everything like that, the inflammation, like Abby was talking about. So I think we started out as Lyme, and we're still heavy Lyme, but we're thinking on a much bigger One Health picture, like Howie and I talked about a couple of weeks ago.
yeah. So what's happening is that a lot of these organizations are becoming more and more similar in their vision and mission, and separately we have a nice small group. We don't have a larger voice to influence or turn the big ship of healthcare in a better direction. And so, my life's mission is to bring the groups like ACAM and ILADS together to work together, work more closely, and with health coaches, because ultimately there is so much work to be done. And I know, Avi, we welcome health coaches to be part of the ACAM meetings and learn with us and help us treat more patients. I mean, if we get all the information presented and compacted, somebody does the work for us, we can see a lot more patients and help a lot more people get more optimal results.
Well, I think that the model I would say right now is the best model is to have an army of health coaches trained under folks like Susan that have a set of protocols, set of guidances, whether you want to put it into a computer or not with AI and all this business going on now. That's great. But that's what you need with a coherent group of well-trained specialists. That one of the medical specialists, and one of the problems is we don't have a lot of those. We have, I think, we have very interested health coaches because they understand that if you can take care of someone who's really sick, you actually learn a lot about how to stay healthy. So that concept is already established in whether it's weightlifters or super athletes or health coaches. They already understand this. They don't have to be sick, ready to die in order to get the message. But the doctors seem to be the more difficult nut to crack. And hopefully we can do that with ACAM, APMD, and ILADS. I think that ILADS is a national treasure that's been just ignored, and I mean, to a certain extent ignored by the establishment. And then again, it has to be eroded, slowly eroded. So because it's no different. Once ILADS gets their knowledge base together, it's no different than ultimately, and it's an aging strategy. It's a health strategy.
But one of the other groups, Avi, I have attended conferences for the last 3 years. Well, I attend conferences all over the country, but there's another particular group, the Forum for Integrative Medicine. And they're wonderful in terms of bringing together physicians dealing with inflammation and chronic illness from all different angles, and having the opportunity to share with these physicians and discuss case studies and how we go about things. And I saw that someone mentioned 5G, which is very, very important. It's something I ask all my clients about. I address this, provide some ideas for them in dealing with 5G, having a master switch in their home, especially their bedroom where everything gets turned off at night. I'm working with a child with Asperger's, and it's one of the things the parents have done. Many of these kids that have autistic spectrum disorders, they cannot tolerate a cell phone and cannot tolerate this kind of frequency. So these are all the things we're looking at in the world: the pesticides, the glyphosates, the heavy metals, the fumes. I mean,
Yes.
there isn't anything today that we don't have to deal with, which is why I think we're seeing so much chronic illness.
And I think that, to Howie's point, certain folks that are passionate, we have to use them as for their passion, and Howie's passion, Dr. Hendon's passion, is to bring groups together, and that's why I want to work with him going forward. Whether it's oral, it's the airway, or it's oral systemic health, or it's the mold Lyme connections that are again feeding us into the world of system repair. This is ultimately the future of medicine if you want to live this way. If you want to live a healthier life and not focus on it's okay to be in a nursing home when I'm 75 years old, then you have to go this route. There's no great alternative unless you're one in the 5,000 people that are genetically inclined to live to 100. Then you're going to need to go this route.
So, Susan, if we were to ask you to create a mentorship program under ACAM for health coaches, would you be interested in doing that?
I'd be thrilled to do that.
Good. So,
One of the things I've thought about.
and this is recorded, so that's good. So we have a couple of. Let's just go through questions. There's a question. What are some of the symptoms that you use to suspect Bartonella? Steve?
Is he there?
I think we lost him again.
Okay. All right. Well, I certainly look at neurological issues. One of the things about Dr. Bock is, Steve, that he does a physical exam, and one of the things that can be easily revealed are the red vertical, what appear to be stretch marks on the body. And it's amazing how someone is not aware if they've got Bartonella. They don't understand the link between their cats, and which, while considered domestic, really are not. And cat scratch fever really can lead to serious issues. Again, he talked about certain kind of headaches. He talked about certain kind of pain. Again, the neurological issues. There's also joint, but the neurological issues I consider with Bartonella to be very, very significant. The babesia, it's different. You're looking at people that have night sweats, and many women think, oh, it's their hormones, but it's not. They wake up in drenching sweats, and that could be babesia as an example. So when the questionnaires I use, and Dr. Richard Horowitz gave me personal permission to use his MSIS questionnaire, which has 70% reliability. I use a variety of questionnaires that will hone in, and now even looking at, I have a questionnaire I've developed about hypercoagulability, because I think that is so important. So these are all the kinds of things we're looking, but a lot of things come together. You don't always know. Is it a parasite? Is it Candida? Is it babesia? Is it Bartonella? Because it's as if they've all come together, and it's hard to separate. But ultimately, again, with testing and listening to the patient, listening to what they are revealing, and it amazes me how I work with people for a long time, and then suddenly they'll share something with me that they've never shared. Well, I didn't think about it. You know, it didn't seem important. It didn't seem to be the kind of thing you would need to know. But those kinds of pieces of data, that information that they provide, open up a whole world of other areas that we need to look at. And I think that's what makes what I do, and that's why I call myself a medical detective, is really looking at the clues, listening to the patient, having the time to go beyond that hour, hour and a half, or potentially 2 hours to work with them and to present the information to the doctor, and reach out to the doctor when there's an issue with medication or supplements or irritable bowel or whatever it is. And again,
Susan,
yes.
that I want to just get a couple more questions. Like,
Okay.
one of the concerns is you're a health coach. You're giving medical. What is your legally? Can you talk to people in different states? Do you how do you protect yourself from somebody being unhappy with your treatment? Do you have the same? You have to have insurance like medical doctors have.
Right.
Talk a few. Give us a
Okay.
brief
Sure.
answer to that.
So actually, I have just finished, because I'm going out into the world to share more of my knowledge, information with clients. I work with, and actually I'm a malpractice attorney. Their area is in the law in Georgia, but there's every different state, and I have clients in different states. So you're never fully protected, but I have an agreement now that my client and I will sign that clearly indicates I am not a doctor. I can't make a diagnosis. I might say, I think this might be, but that's where my relationship with a physician is going forward. But I certainly do make very clear what it is I do, how I do it, how I work with them, and should I want to reach, for instance, out with another doctor or specialist, I do have to have written permission from my client anytime that occurs. So I am truly trying to be careful and understanding, but as my attorney said to me, when they first spoke to me, they said, well, let's talk to someone else that does what you do. And I said, well, that would be great, but there is no one doing what I do in the country. And it is because of my background and my training. I mean, I started attending ACAM meetings back in the 70s, and American Academy of Environmental Medicine. I also, by the way, was president and headed up an FDA-reviewed, IRB-approved study on the use of injectable growth hormone in anti-aging. So I bring a lot of information, and my desire and my passion is to keep learning something every single day. I can do that with my doctors. I can do that with my conferences. And again, I'd be happy to share and work on coming up with a program to teach other people. If they're willing to take the time and they're willing to spend the time with their clients, it's extremely rewarding.
Susan,
yes.
while you've been talking, 2 people have signed up for your course that you're not giving already. So we might want that, so that anybody who's a health coach on who's attending this webinar who wants more information, I guess the best thing to go is to contact ACAM and let your desires be known. And if there is enough interest, ACAM can put together a course that will be the best course there is on being a health coach. And in addition to that, connect you as a health coach to integrative physicians.
I would love that.
And I'm sure we can get Steve to maybe work with ACAM, ILADS work with ACAM on this project to increase the growth of health coaches.
Absolutely.
And so, Jordan, are you there?
Yes, sir.
Have we reached the end of our allotted time?
So we have reached the end of our allotted time. Most of the questions definitely were covered, and if not, I'll be going through them, and I'll reach out to the people who submitted those questions, and we'll get a follow-up going. But other than that, we just want to thank each one of you specifically for getting on here, as well as all the ACAM members that jumped on and additional people. So with that being said, Dr. Herskowitz, any closing remarks?
Well, no, I think it's all been well said, and I thank everyone for participating. Again, it's Howie's vision of collaborating across different lineages, across different philosophies, across different specialties that bring this type of a meeting together. And I think ACAM, APMD, groups like ILADS, and the environmental groups, the toxicology groups all need to get together and figure out how to get to more people, because our academic colleagues are going to stay a little bit behind. And if you want to stay ahead of the curve, I think this is the right approach. We'll see how we end up meeting together in the fall. ACAM and APMD will have their annual meetings in mid-November, but we'll probably end up going completely online and digital to that meeting. So we're working on that to make sure that we get something that's really relevant for today, immunomodulatory, so to speak, to make sure it's relevant, and get everyone excited going into that season, into the fall season.
I'm hoping too, by the way, if we're doing something like this, I would love to be able to do more of this with Dr. Bock, so that other physicians would begin to get comfortable around what it is that a health coach can do for them.
Yes.
And I think that that's very important. And the same thing, I actually do have a dentist here that has started referring clients to me. That's very exciting, but it's very slow to happen. And what if they would understand that I am there as a piece of this puzzle that's helping to provide information, support, and caring in a very comprehensive way, and helping them to do their job. One of my doctors says to me, down in Atlanta, he says, when I walk in and I have presented a report and a case, he can almost sit back and relax. Now, that's not exactly the case, but I have presented so much information, and that it enables him to move forward in a more relaxed fashion. And I'm hoping that I can share that with more. Happy to share that with coaches, and would love to share that with more physicians.
Susan, you've done such a great job. A third person has already signed up for your course that doesn't exist. And somebody who is an AAPMD member wants to know how AAPMD members, will they get the information, because people who are part of the AAPMD community, be they dental hygienists or myofunctional therapists, there's no reason they can't become health coaches also. They will be such an asset to a dental practice, because they can really help convert a dental practice into a wellness practice. So I think, and there were incredibly wonderful comments how much people enjoyed this. This could really be the beginning of something very special. So we should mark the date.
Okay, let's do it again, and let's get Dr. Bock to be able to be online and talking together.
And I want to tell, on behalf of Jordan, usually these webinars go a lot smoother without all these interruptions. And Jordan, we're not going to blame you this time, but maybe next time.
Yeah, I'm not. Well, I'll definitely be doing some technical review.
We can blame New York. Okay.
Yeah.
Okay. So,
all right.
good
All
night,
right,
everybody.
guys.
Good night.
Bye.
Thank you for having me.
Yes, ma'am.
Speak to you soon.
Bye-bye.
Night, Harry.
Good night.
Night, Avi.